would like to extend a warm welcome to those who are joining us today and those of you who will view this recorded webinar at a later date. The topic for today's webinar is incorporating cultural context into routine and emergency response communications. A few notes for you before we get started. This webinar is being recorded and will be placed on an emergency preparedness and response online curriculum hub. The Curriculum Hub, upon its completion, will be a free and open source for emergency preparedness and response content and curricula. We look forward to engaging with those of you who have joined us today and will do so during the Q&A portion of the webinar, which will follow the presentation. That being said, feel free to add questions via the Q&A window throughout the presentation. We are joined today by students, faculty, and staff from Minnesota Private College Council member institutions, our partners from the Minnesota Department of Health, representatives from the Minnesota colleges and universities, and our guest speaker, Lillian McDonald. Again, we're glad you're with us. We begin with honor and respect for the land and for the first people of this land. We are on the ancestral homelands of the Dakota people. We desire to honor and respect the first people and recognize their caring for our common home. Other sovereign American Indian nations, including the Anishinaabe, also have a long history with these sacred lands, past, present, and future. We, both personally and collectively, continue to have a deepening awareness of our complicity, of the complex history of colonialism, genocide, and broken treaties. We seek to understand the troubled acquisition of this land by unjust U.S. government practices, including the stealing of these lands and the forced removal from the birthplace of the Dakota people without any compensation to the American Indian communities. We acknowledge the past, current, and future impacts of this history on our relationship with our American Indian sisters and brothers. My name is Kathy Berlin, and I'm pleased to serve as the host for today's webinar. I'm working with Jenny Klusnick, who's also here participating in the webinar. We are the project consultants for the Emergency Preparedness Project. This webinar and support for the overall Emergency Preparedness and Response Project was made possible through a grant fund from the Centers for Disease Control and Prevention and is being administered by the Minnesota Department of Health. The objectives listed on this slide are the topics our guest speaker will address in the presentation. I'll give you a minute to take a look at those. And I have crossed paths with our guest speaker, Lillian McDonald, several times in my 20-year career in emergency preparedness and response. Every time we work together, I'm reminded of the leadership Lillian has provided in the realm of emergency communications. I, like many of my colleagues in local, state, and national public health, particularly admire her work establishing emergency preparedness and response outreach communication systems and modalities to diverse communities. Lillian is indeed a leader and pioneer in public health and safety communications, and I am pleased she is able to join us today. And Lynn, I'll hand it over to you and I'll stop sharing here.
Wow, Kathy, what a very kind and generous introduction. Thank you very much. And thank you, everybody, for being here and taking an interest in this work. I think we're all passionate. I tend to find folks in public health, public safety, public service, quite frankly, are always very, very, very passionate and interested in doing the very best we can. So I really appreciate being here today. And I'm grateful for this opportunity very much. What I'd like to do is give you a little introduction about who I am and how I got here, because it was not a straightforward path. Most things in communication are not straightforward. And there's a reason that I want to kind of set that backdrop, because it'll help tell the story for what I do today. And hopefully it'll bring up some things. We're living at a fascinating time right now. If you have an interest in public service, in cultural communications, and in emergency response, because with all the new technologies that are going on today, artificial intelligence, to name one of the many tools that are out there. We're on a collision course right now. And I find at this time in my career, this to be a fascinating time. So I hope when we get a chance to have some questions and answers back and forth, we can probe the future a little bit and see what impact it might have. So today's focus is on incorporating cultural context, into routine and emergency response communications. And that's really important. It's not just language. You'll hear me say that this is not just translations. There is a lot that goes into it. That's the context part. And especially today when we have an evolving world, both demographically and through technology and through trial and error on the heels of a pandemic, on the heels of civic engagement challenges that are going on across the world, quite frankly. So why does this even interest me? This work interests me because I've been in the media for 20 years. So as a reporter, my job was to go out into the community and find news and tell the truth and find stories, or with two sides of every story. There's always more than two sides to any story, but typically in media, we boil it down to, what's right, what's wrong in a story, and we let the end user decide what's right and what's wrong. I left 20 years of media to really, I wanted to give back to communities because I recognized that I had a lot of communication skills. I hit the 40 mark, and I wanted to figure out how do I give back somehow to communities, because they had served me so well in the media. And so I worked with public health officials where I found a gold mine of information, a boatload of undertold stories, and some fabulous work that people just don't understand what goes into public health as a whole in terms of prevention and care. And boy, did that make a difference during COVID. And then it's all complicated by communication strategies. And part of that work was also done alongside FEMA. I am a FEMA public information officer. I've been pulled to serve on a few national crises like Katrina, Rita, mostly hurricanes. I only get the big ones because they need to have enough public information officers to manage huge communication challenges, especially in real time when there's a major disaster. I really did learn a lot from the FEMA adventures that I had, and I've learned to incorporate some of those communication under pressure into my work. So what you see on the left side of the screen is a snapshot of the work I'm doing today. I work for public media. And one of the things that I was able to do, I started a nonprofit when I left television news, and the nonprofit was frankly funded and supported by public health and public safety agencies back in 2004, when they were trying to figure out how are we going to close the gap on communications with cultures. And my idea was to simply do what we always do, but invite cultures into the process. So create multimedia products while you are inviting multilingual, multi-communities to sit around the table with government officials and figure out, what does the messaging need to be? Who should get the message? How should we deliver it? And how often? And so that work, after 10 years, merged with Twin Cities Public Television, because we were able to figure out not only how to do this on a routine basis, but how to do it in real time and whenever there's an emergency, through the emergency alert system and some other strategies. So the shot that you see on the left side of the screen is a snapshot of a TV channel that I lead called TPT Now here in the Twin Cities area. And there are several other PBS stations that are looking at patterning some sub-channels by incorporating weather, health, and safety information in different languages, all on a TV screen. It's not a show that you tune into at 4, 5, 6, 9, or 10. It's something that you have on in the background, sort of like on-demand content, and you go to it when you're looking for regular information on a daily basis. But in a crisis, we actually can dedicate the channel to broadcast far and wide in different languages, reaching cultural communities, and we did a ton of it for COVID. This clip here on the right side is about 3 minutes long, and it really will give you a snapshot of our work. So with that, I'm going to go ahead and give it a shout out.
Hola, mi nombre es María Isa y soy artista aquí en Minnesota. cudurkan inaan
TPT Now is the nation's first 24/7 television channel that broadcasts real-time weather and emergency alerts in English, Spanish, Hmong, and Somali to reach diverse communities. But TPT Now is more than just a weather channel. With content in multiple languages, TPT Now programming helps Minnesotans be informed, healthy, safe, and ready for emergencies.
We should point out that there were many natives involved in Pfizer's vaccine trial, and native medical experts like Dr. Mary Owen are committed to the health of native communities and are paying close attention.
Práctica cualquier doctor que le administre la vacuna está todavía regido por las leyes de IPA, las cuales se supone
que te autopapi do kikia je quando ye ko autobusa de go chuto o para go do kintia para go
soo vaccine-ku qofka oo dadka community-geena oo ku saacideyn kara ku ugu asxaanfali karaa inay difaac sameeyaan ka hor intaysa jiradii ku dhicin markay jiradii ku dhacdo hadduu immune-kaaga ama
TPT Now goes live in multiple languages with important health and safety updates on behalf of its state and local officials.
It's also engagement of people. Once we get the message out, then what? And that's the other phase that we have to go through with all this technology too, is engaging populations from different languages, different cultures into our systems so that we all know how to respond.
TPT Now creates original content that is written in partnership with and delivered by trusted voices from the community. And they partner with government, community media, and key leaders to prepare and distribute that content.
Cái lỗ thâu coronavirus nó giống mùi chả là vì thế nó giờ đây ôi không mình mấy là 8,000 ca là tụ là yên tàu còn là yên là 8,000 ca là sẽ được.
TPT Now is more than just broadcast television. With a widespread and growing digital presence, TPT Now uses organic reach and paid social media campaigns to get important information in front of even more eyes. TPT Now is Minnesota's go-to source for health and safety information.
Yeah, I hope that sort of give you a pretty quick overview of what this channel does and the mission of the channel and how we do our work. And some of this has to do with, this is an engagement activity I want to do with you next. This is probably the hardest lesson I had to learn in the course of the evolution of my work too. And just to sort of kick you off in this process, I want you to join me. And this is tricky to do virtually. You talk about communication, the virtual world has pretty much put us upside down, but I'd like you to do this with me now. And I know we have roughly 12 people on our webinar right now. And even if you are watching the recording of this, I dare say you should try this with us and not be a passive viewer to take this test. We're going to take 2 tests. This is the first one of 2 slides. I'd like you to open up your microphone. And I want to hear everybody. So I want you to just name your name when you open up your microphone. I want to just do a mic check myself. So everybody, please open up your microphone and on the snap of my finger, just go ahead and shout out your name. Everybody talks at the same time. So your microphone should be open now. And here comes the snap of my finger. You're going to give me your name. 3, 2, 1.
Debbie.
Anita.
Perfect. Okay, thank you. Now we are going to keep our microphones on. And I want you to take this test, okay? It's called a Stroop test. And more on about the Stroop test in a moment. But essentially, it's going to reveal, I hope, some information and get you to think about yourself. This is a great opportunity for us to think about, what do I need to know to improve my ability to work with cultures and communication. So this is a Stroop test. And what I want you to do is we're going to take the first test before the second test. All right. So I just want you, with your mics open, reading left to right from the upper left-hand corner. Okay. So we read left to right. So we're going to start with red. And I want you to read left to right, line by line, on the count of my fingers. Just read it out loud. Tell me what you see, and go ahead and read out loud in 3, 2, 1.
Red,
green, blue, yellow, pink, orange, blue, green, blue, white, green, yellow, orange, blue, white, brown, red, blue, yellow, green, pink, yellow, green, blue, red.
Very good. Now, you know what? I'm amazed. I've done this a couple times virtually now, and I'm amazed how it comes out. The pacing of people is a little bit different. So some are a little further ahead and some are a little bit further behind. The clarity is wonderful. And I believe you are reading what you see. Now, what I'd like you to do is we're going to take the same kind of tests, and I want you to read again the color of the word of what you see on the screen. Okay. Again, reading out loud. Please keep your microphone on. And while you're reading, listen to others and see if you learn anything. And then I'm going to ask a couple questions. Here we go. On the count of 3 and the click of my fingers, begin to read in 3, 2, 1.
Red, green, blue, yellow, pink, orange, blue, green,
orange,
white,
blue,
green, yellow, orange, blue, white, brown, red, blue, yellow, green, pink, yellow, green, blue, red.
yellow,
pink,
green.
Wow. Okay. Now it's your turn to, I want to hear from you. I'll just turn my slide down for a second here. I guess I can't do that. All right. Tell me out loud, throw your camera on if you don't mind. Tell me what you learned or thought about or experienced when you were doing the Stroop test. Anybody? No right or wrong answers, just throw it out there.
This is Jenny. I found I had to focus.
On the second slide.
Second set, yes.
Yeah. You had to
I was
focus.
slower.
Yep.
To get to the answer, I had to focus more and really concentrate in a way I didn't on the first word set.
Really like that learning. So you had to focus, and to focus, you had to slow down. That's a key observation. What else is out there?
I actually had to use my finger on the screen to
Oh, really?
stay on task.
Good for you.
I guess it helps
And
focus.
so you know something now about yourself. To help you focus, you actually put your finger on the screen so that you didn't miss anything, so that you were really clear about, is this the right word? Because, you know, obviously the difference between the first set and the second set are the colors, right? So the first set, they are what it says. On the second set, you have to really read the word, consume the information, and then decide what is the answer, and then recite it in the context of the exercise.
And deal with the cognitive dissonance.
And I don't know who said that. Who said that?
Debbie.
Debbie, the dissonance of that moment is exactly the love of my work. And it is what I find not only the most complicated, but the most important part of any message. It's very easy to come up with words. And some would say it's easy to just translate words. But really, we are more than words. We are really the context and the perception of how we interpret and consume that information. That is how we base the decisions we make on that message. And I love this little Stroop test because it's a really simple way of demonstrating unconscious bias. In our minds are all kinds of biases that are going on all at once in the course of a conversation, from what we see, from how well we are focused, from what we're interested in, from the distractions in our own lives, to the distractions in the other lives of the people that we are communicating with in the moment. And inside all of that are the biases that we all bring to the table. And so really understanding what we need to focus and to address dissonance and the context of a conversation to understand the meaning is the challenge of the world we all live in every single day. And what I'm finding with technology is we are actually skipping a few beats in that process, and it could be dangerous downstream. There is some value in the speed because in an emergency, we need to talk quick. I mean, that's why we have a whole alerting system, is so that we can in real time tell people to duck and cover. But in reality, there's so much more to the story. And so that is our challenge in this work, especially in a day and age when, of course, we know that the demographics are changing. We can see them in our own neighborhoods, communities, and travels. Here in Minnesota in particular, the demographic growth is amazing. We have, over 262 ethnic groups, 778 native tribes. 40% of Black residents identify as from the Caribbean or African. The second largest Somali community, the third largest Hmong community, and Mexicans are fast growing here in Minnesota. So there's some data out there that suggests that by 2030, the minority population, which we're the majority now, the Caucasian white population, but that will be gone pretty soon. And so getting to understand the complexities of cultures, communication, and dialogue and distribution in today's technology world is really key for daily communications and crisis communications. In a nutshell, here's the situation. More than 26 million people in the country as a whole do not speak English fluently. So at the end of the day, if you're responsible for alert and warning systems, you're not resourced to translate quickly. And even on the age of artificial intelligence, we can't use that in a system that requires life or death saving information in a heartbeat of time. So that's a real big problem in this country. Smaller countries are using some tools effectively to be efficient and clear. But here in this country, we're still trying to figure out how can we get the job done. And there are, sadly, tragedies from hurricanes, wildfires, tornadoes, and floods, where these families that you see here on screen did not get the message in a language they learned first. And as a result, they were, by the time they got through the understanding of the message, the context, let alone where are the resources and what should I do and where do I go, it was too late. So there are some new advances in technology now to try to solve these very problems in emergency alerting. I know the National Weather Service is experimenting with AI. They have asked my help with Hmong and Somali languages. I know the FEMA and the Federal Communications Commission are working on the top 13 languages in the country, including ASL, which I actually consider a language, right along with ESL, English Second Language, and American Sign Language. But these are very challenging contexts of communication to get out quickly. And the buildup of that information, what we call preparedness content, and in public health, there's a ton of it, is getting people ready and learned, if you will, about public health information or safety information, so that when they are under pressure to perform quickly, they can actually get the job done. This is a snapshot of languages by the National Weather Service, hotspots, I call it. 1 dot equals 150 limited English proficiency people. And so you can see from the red dots on this map, that's mostly Spanish-speaking people, just the growth. This is a fairly current map too. And if you look in the right bottom of this screen, you can see the top 13 languages that federal officials are focusing on. I won't get into a debate right now about the top 13, which ones are right or which ones are wrong. Remember, in Minnesota alone, we have over 270 dialects. You can imagine what that translates to across the country. But basically, the top 13 were chosen by census data, and also some tools that are being used where these populations are mostly dominant. New York City, to name one place. But as you can see, the growth of interest just by trying to be able to get weather alerts out there quickly to demographics whose primary language is not English, to save lives, it's a huge undertaking right now. And the blend of technology and the blend of people power and the blend of communities and cultures coming together, it's rapidly moving. And this map, the colors on this map are going to be completely different, way more filled in, if you will, by 2050. In Minnesota, we had a north side tornado. There was a fatality in probably one of the most densest and culturally predominant communities, not too far from my neighborhood, actually. And it was a blowout. It was a blowout because by the time the message came, most of these populations were underinformed, didn't know what to do, where to go, but they did find their own unique ways of communicating, coming together, and becoming resilient post-tornado. And we've been taking learnings from every single crisis here locally and nationally to try to improve these systems, whether it's the workflow that gets the message out end to end, the technology that does the same end to end, and the translation that happens in between from public officials on both the health and safety side. Back to the TPT Now channel, our mission is to basically try to use broadcast tools to help support and fill the gaps for health and safety officials. We believe in engagement, and so we work with government and cultural leaders. We engage, we get them around the table, and we say, here's a crisis, here's a prevention topic, and then let's develop and distribute what needs to be the key messages for each community so that the content actually makes sense. It's relevant for those communities, not just sort of one size fits all. And then on the right side of the screen is an actual sample of an emergency alert. We do them in 4 languages. We were the first in the country to do English, Spanish, Hmong, and Somali on the air. And right now we're the only entity doing all 4 languages on the air. Some places are now doing English and Spanish through warning and alerting tools. And trust me, in the next 5 years, more places will be adding Spanish. And if FEMA and the FCC get through a few of their hurdles in about 3 to 5 years, those 13 languages might actually have some mechanisms. We reach 1 million households. Again, I mentioned the Twin Cities and surrounding areas. We're housed on channel 2.5. It's a sub-channel of Twin Cities Public Television. And we provide about almost 3,000 different pieces of content every day. And we circulate a lot of content through partners so that they can put it on their own websites, digital platforms, and elsewhere. Our goal is to centralize the work so that we can push out a standardized message that's customized for each community by key leaders, so that you feel like you're being seen and heard and working with key leaders in your own community, not just government officials. Words really do matter. So when people ask me all the time, well, how do I even put this together? I'm a really big believer of keep it simple. I love templates. I love spreadsheets. I might be a nerd, but at the end of the day, you really want to, people can only think of the top 3 things, the top 3 things on my grocery list, the top 3 things I want to get done today, the top 3 things I hope happens in this year, right? The top 3 things I want for Christmas. So at the end of the day, when I put messaging together, I try to limit what are the top 3 things and say it in a sentence, not a paragraph. Key message number 1, what's the top sentence? Key message 2, new topic, top sentence, and key message number 3, top sentence. So I have 3 sentences, and then I might have 1 or 2 words. Notice I said a couple words underneath each key message, just in case I get to drill down a little bit deeper. In television news, that's our secret too. We can only, as reporters, remember probably 3 top facts of the story of the day. And then we just try to add 1 or 2 keywords underneath each of those facts so that if we're doing a live shot or we're going to talk for, 60 seconds on the air, we don't have to remember tons of dialogue. We just need to remember the top 3 key messages and a fact or 2 underneath it to carry on the conversation if we're asked for much more than that. The approach of the work that I do is always engagement. It is always involving people around the table. And yes, it does take a little bit longer. So for routine communication, whether it's health, safety, human services, it doesn't matter. We work with the government agency to say, okay, what are your top 3 messages? Then we work with the cultural communities. What are your top 3 needs or concerns? Then we see if that content even matters, comes together appropriately. We sit down around the table and we decide who should deliver the message, why, in which format, how can we make it visible? Because people aren't reading a lot these days. They really just want the short formats. They want to be able to consume it quick, kind of like on-the-go information. And we're very sensitive to making sure not only our culture's involved, but young and old, men and women, faith-based, maybe it's a community owner. So it doesn't have to be the most famous person in the community. In fact, I'd prefer to just work with the regular folks that are getting attention in communities. Not always the activist, but the trusted voice of a community. And so we try to maintain a Rolodex of relationships, and agencies should too keep their own relationships. Now, this is our best kept secret, and it's right here for everybody to see because we are pretty transparent about how do we get it done. Once we get the messages put together as prescribed by public officials and then communities, we actually produce it in a variety of formats, and then we push it out. So the big circle in the middle is basically all that behind the scenes work that gets done. And then we give the content away and incentivize each of the communities to use their own platforms to push it out. I used to try to get everybody to come to me and watch my stuff, but I am finding that I cannot really get good metrics that way. They want to hear the message from and within their own communities. And so I work with community media, cultural media, and many others. There's a whole listserv. There are about 45 in the entire state. Multimedia and multi-platform and multimedia marketing agencies. Boy, that's a lot of M's. But at the end of the day, only 45. And most of them, I mean like 40 of them, specialize in a single language. So there are only a handful that specialize in working with many languages on many platforms. Engaging with people is everything. Engage with them where they are. In person, on the air, on socials, on the street, at their community engagement sites, in their businesses. It really is the key to engaging. We did, for COVID, 64 press conferences in real time in 4 languages. We went from a platform with 0 to a platform of 1.7 million. It was a hot topic. There were no utilities available to reach ESL or LEP communities. So this really worked out well for us. Kudos to the Minnesota Department of Health for trusting us to be part of that process. The commissioner and that whole team worked with us on a variety of different content tools, and it helped fill a void. For a Blue Cross Blue Shield project, we did a full year of specialized COVID content and on broadcast and social media platforms, including live social media, so they could actually write and talk back and forth to us or chat with us. We reached 4 million impressions, 2 million in reach, and 484,000 engagements. When you engage with somebody, that means you're actually having a conversation with somebody. So at a time when we were trying to figure out how do we fill these gaps, we were, I don't want to say a drop in the bucket because we had more impact than a drop, but we were at least something that people could gravitate to, share, reshare. Everything is, again, recorded and reshared because some people couldn't get to it until night. Some people couldn't get to it for a variety of reasons, but eventually they did and got some information. We did a hate crimes program. Hate crimes were really up during COVID, and the FBI came to us and said, we got a really big problem. Can you help us with that? So we went to the key leaders directly, particularly in the Asian and Somali communities where they were having the biggest problems, and asked them what was going on. And they were afraid to tell us. They were afraid to tell government. And that's actually the reason why we kind of played the middle person, and they were able to tell us, and then we were able to create messaging that had significant impact. The Somali community really resonated with a public service announcement that I'll play here really quick. It's only 30 seconds, but it got shared and reshared. Now let's you give a listen.
Sidee ku garan kartaa in dambi cunsurinimo ah laga galay ama aad markhaati ka tahay? Dambiga cunsurinimo wuxuu noqon karaa mid lala beegsado shakhsi ama dhismo. Inkastoo dagaalada noocaas ah lagu qaado hal qof ama hal meel, waxay saamaysaa bulshada oo dhan. Inkastoo sababaha qof lagu cunsuriyeeyo ay badanaa tahay jinsiyadiisa ama diintiisa, misna waxa kaloo qof lagu cunsuriyeeyaa waxyaabahan. Dadka dawladda uma sheegaan marka fal cunsurinimo ah lagula kaco, waxay badanaa ka baqaan in ayagu dib uga timaado, ama wax laga qaban waayo, ama in sharciga dalka ay ku joogaan su'aal laga geliyo. Si aan u badbaadino bulshooyinkeena, waa inaan dawladda u sheegnaa wixii naceeb ah oo aan aragno. Sidan ayaad wax uga qaban kartaa naceebka cunsuriyeysan. Wac FBI-da lambarkeedu waa 1800-225-5324 ama gal website-kooda tips.fbi.gov. U sheeg waxa kugu dhacay FBI-da. Iyagana way baarayaan falalka ku salaysan naceebka.
It's on a loop. Sorry about that. Longer than 30 seconds. I should have known better. Somali language, this is the way it is. What I like about this campaign, I'm really proud of, is the FBI, Minnesota, and North Dakota agencies circulated this far and wide over a 6-week campaign and saw a 32% increase in calls to their hate crime tip line, which meant a lot to me. And 32% meaning from Asians and Somali populations. And so that's a big jump for them. And I'm just grateful for the key leaders that really knuckled down with us to get the right message out. We've done some national campaigns too. This is how do we reach parents and caregivers about rail safety. So this is how, again, penetrating markets with a lot of different ways to present information to communities, podcasts, storytelling, newsletters, yes, television, yes, PSAs, but events and activities, meeting with children, meeting with parents. It was interesting, this campaign, and I had to think about it for a second, but most parents are worried about their kids having sex, or their kids doing drugs, or their kids driving a car inappropriately. But at the end of the day, nobody's having conversations about rail safety. So we also worked with our educational program, created a curriculum, and put it in classrooms so that teachers could work with children and children could take it home and it would become a conversation. So again, it was a strategy that we engaged with Union Pacific over 2 years. And we did see some penetration and change in outcomes there. One of the videos, and I won't play it because I'm realizing it's a little bit longer. You may have some time here, to ask some questions. But one of our videos actually went viral, and it's really hard to get content to go viral. It was an accident, but it was a 3-minute, and that's what's here in the queue, a 3-minute piece in the Spanish language that went viral on our YouTube page. And started getting tossed around in Mexico, Puerto Rico, I want to say Colombia. I could be wrong on that. When we dug deeper to find out why, we found out that it was in other countries in particular, there's such little information in a media format that having the visuals really made a difference. And it's the reason why we think it went viral. So we've had that happen with a couple of different things that we've produced on social media, and it's given us great joy. There's a lot of good feelings, as I know there is in any public service career, that when you feel like you're making a difference, even if it is a little bit, it's better than nothing at all. Oh, here it's gonna start playing.
Hola, Soy la conductora Connie y este es mi tren.
I'll stop there. That's Connie. This was an animated campaign. One of the strategies that Union Pacific also wanted to do was dispel the myth that only men are train engineers, and only white men are train engineers. So this campaign was not just for the public, but it was also to establish some DEI priorities for the organization so that they could start to showcase themselves as a more inclusive employer, and willing to train, willing to serve, and willing to step outside the box of the traditional career in the rail industry. So we kind of did this campaign from the inside out and from the outside in. And we reached 13 million in the end. It also was a 6-week campaign in the 5 different states, 6 different broadcast markets, two languages, English and Spanish alone. So we were just really pleased with Connie's outcome. Now, this here is basically my pitch, because everybody's like, it costs too much money to do this work. The fact of the matter is, and this is research, for every dollar you spend on mitigation, meaning for every dollar we do today to help people be ready for emergencies tomorrow, you actually save $6 on disaster losses. Because when people don't know what to do when the pressure is on, they actually cost a lot more money. And so the goal is prevention, prevention, prevention. But I know I'm preaching to the choir because you're public health folks primarily. And as a result, I think you know that already. But I always include it in my slides because it's a reminder that there are costs that come with this work, but the investment is a savings in the long run. FEMA, this is the 2019 report. They've been coming along and preaching whole community preparedness for a long time, but it was actually COVID that got them to change the strategies of how they do this work and making inclusiveness and equity in their disparities a priority. So the strategic plan for 2024, 5, and 6 calls for cultivating a much more diverse workforce at FEMA, removing some FEMA barriers, and working on equitable outcomes. You know, I hate to say it, we knew that health and safety disparities existed before COVID, but it took a crisis to raise all of that forward in our thinking. And sometimes that's just how the work goes. My hope is that I know we have short memories as human beings, but my hope is that we'll make enough investments post-COVID that they will make a difference in any future crisis. So we do try to work with partnerships. They do help maximize the reach. We're a tiny team at TPT, to be honest with you. And so we believe in giving the work to others. We don't charge for it. It's for you. If you reshare, that's a good deal. So cultures help evolve, and they help by co-creating. You've created new opportunities. You can overcome engagement limitations when you develop engagement regions. Cultural communications is costly, but again, if you define the deliverables and you share the costs, it's cost effective. Inconsistent initiatives, so we're here today, but we're not there tomorrow, is a real problem. I'm recommending we start to build a baseline of cultural communications into our government services. And perceived competing interests. So in other words, he gets more and she doesn't, or they get more and they won't. You have to supplement the programs and measure all the time for success and equity and outcomes. And with that, it's my thank you to all of you. You're doing the heavy lifting. I get invited to help every now and then. But I'm more than happy to speak offline. You can see and reach us at our URL that's at the bottom of the screen here. My name again is Lillian McDonald. I'm more than happy to talk with you anytime. But because we have time left in our session today, I am actually hoping that there'll be some questions.
Lillian, this is Kathy. We have a couple questions here already. I'll read one for the first one for you. It's, what piece of advice would you give to undergraduate students in public health programs who will soon be entering the workforce?
Well, that's a pretty broad question. I'll answer it in a couple of different ways. When I look back on my own life, what I didn't know then what would I tell her now? Is to, I mean, I have natural drive, so I am always scratching for, give me the best I can learn, and always learn is really number one. Even when you graduate, in fact, I'm doing this now. I'm retooling right now on some of these new tools that are coming into our future. I just think you can't stop learning, and it doesn't always have to be a formal education. Those are helpful. I've always taken, CCU classes or an executive director program, or dropped in at a community course. Talk to your colleagues who might be involved in workshops or whatever. Keep learning. Once we get into jobs and families and things like that, it's really easy to get too busy, and the world is really changing quickly, and we think we're staying up to speed, but we're not unless we're making a conscious effort to keep learning. So that's number one. Number two, I am telling you, as I am here with you right now, I'm speaking to you from the bottom of my heart. We are at a critical communication time with the intersection between cultures, technology, and how do we get the job done, and an over-reliance, and hopefully not an overconfidence in AI. I think AI is a useful tool. It does speed up time. We learned in COVID, we could not get everything communicated and turned around fast enough to help people or public officials. We learned from that. AI will help us speed up. It still, I think, needs to be proofed by a linguist, by a human brain, by somebody who understands the subject and the risks and opportunities with that subject. And yeah, good enough to be under pressure, because in a crisis, all that speeds up. So those are the top two areas. Plus, always take care of yourself. It's a long road ahead.
Thanks, Lillian. And we have time for one more question. What is the most memorable, impactful experience working in the crisis communication? What did you learn from the experience?
I have to tell you too, there's two things. I've often thought to myself this question, and I have to tell you that public officials really do care. And we're also at a time right now when public service is not necessarily valued or viewed as a big value. And I'm talking about police, fire, and public health and public safety. And so the most rewarding work I've ever done is in two places. One, in the middle of a disaster with a bunch of government officials all trying to figure out how to keep people safe and healthy. And two, in a classroom. I have taught students at high school and college, adult learners, and again, hearing and learning from them and how they manage life every day as we all work together as a community to be healthy and safe. Those are rewarding experiences.
Well, thank you, Lillian. Thank you. That's a good segue to my last comments, in that I know Jenny and I will be encouraging the faculty who will be accessing our curriculum hub to utilize this presentation. I think students can learn so much from listening to you. And I think students and all of us in public health have an acute interest in DEI. And I think you touch upon that during your presentation, and we really appreciate that. So thank you, Lillian, for spending time with us today. I'd also like to thank the individuals who joined us today. I really appreciated your willingness to engage in the activity at the beginning of the presentation and then the Q&A session. So thanks to all of you who joined us today. And I'd like to extend a thank you to those of you who will be viewing this webinar at a later date. So that is the end of our presentation. Again, thank you to the participants who joined us and to Lillian McDonald, our guest speaker.